the next from Penn, from the University of Penn, Michelle Fung, who's a rising sophomore, also in the SANS lab.
All right. Hi, everyone. My name is Michelle Fung, and this summer I've also been working at the SANS lab with Fatima here at Harborview. Today I will be presenting on evaluating patient specificity of inlet boundary conditions in computational fluid dynamics for cerebral aneurysms. So I'm going to take that one thing at a time and start with a brief crash course on computational fluid dynamics. So that's also abbreviated as CFD, which is how I'll be referring to it going on this presentation. CFD is using computers to model the flow of fluids. In a clinical context, it can be used to study blood, as it has been found that hemodynamics, which is essentially the physics of blood flow, can have an impact on the pathophysiology of a disease or condition. The main parameter assessed is something called wall shear stress, which in physics terms is the parallel force per unit area within a fluid and between the fluid and the surface it moves against. So think of a blood vessel and the blood moving through that vessel and how that moving blood is going to affect the blood vessel wall. And there is another parameter that's assessed derived from wall shear stress called wall shear stress gradient, which is just the change in wall shear stress. When applied to aneurysm research, CFD can be used to model blood flow through an aneurysm. An aneurysm is a bulge or ballooning in the blood artery wall. And when blood is moving through that aneurysm, it can potentially lead to that aneurysm to a rupture, so like a balloon popping there. And that can be fatal. So hemodynamic data from CFD can be used to assess risk. And while CFD is not currently in clinical use yet, the goal is to be able to have it as a tool in the future to determine patient care for those who have aneurysms. This is a quick version of the process to take a real-life aneurysm and convert it into a CFD model. So first, a model of the aneurysm can be created using 3D angiogram datasets, which are obtained as a part of standard aneurysm care. That model, let's point here. So this is the imaging, and that's going to be converted into a 3D model, and that model is going to be converted into a volumetric mesh. So that just means breaking up the continuous surface of the model into discrete parts where data can be collected or calculated. For the next step, boundary condition determination. If you think of CFD programs as a really bulky calculator, the boundary conditions are the information that you punch into that calculator for it to solve the equations that you want. So those conditions that you determine and that mesh are going to be inputted into a fluid simulation software, and data from that is going to be put into yet another software. From that, data can be extracted and visualized, so like this right here. For my project, I focused on the boundary conditions, specifically the effect of inlet boundary conditions, referring to the flow that is entering the aneurysm in the model. So one of those conditions is that the velocity profile or the speed of the flow entering the aneurysm. So that can be changed in the model. And we use Fourier decomposition to mathematically define the velocity profile. So Fourier coefficients are inputted into the simulation. You determine the coefficients, they're inputted into the simulation, and the simulation is going to interpret that as the velocity profile and how that flow is going to be modeled. For this case study, I ran CFD simulations using standardized inlet boundary conditions to compare to existing simulations we had already run that used patient-specific inlet boundary conditions. The patient-specific inlet boundary conditions used patient demographic data in their generation, whereas for the standardized inlet boundary conditions that I used the healthy patient data, which is not specific to any patient, but numbers that were averaged using the demographic data for aneurysm patients that we have on file. All other aspects of the standardized simulations were kept patient-specific, and the Fourier coefficients that I used to define the velocity profiles I just mentioned were generated using a machine learning Python script. So that script was trained on directly measured patient data and used the demographic data or standardized healthy patient data to output those coefficients for us to use in the simulation. So here are the results. These are 2 of the simulations that I ran out of a total of 4. So you can see that there is some variation in both of the velocity profiles. So patient-specific is in blue and standardized inlet boundary conditions are in yellow. These don't look very similar, and they're also different at various time points. This is over 1 cardiac cycle. And you can also see that for these 2 patients between them, they have variation in different points between both of them. You might also see that this one on the right-hand side here, it looks like it's a lot closer as in like the standardized inlet boundary condition velocity profile graph is a lot closer to the patient-specific one compared to this first one. However, if you look at the output data from the CFD simulations, you can see that the percent change between wall shear stress and wall shear stress gradient are higher than the patient on the left, where it looked like the graph was a lot more different. These results are also visualized here on these heat maps of the aneurysm dome. So that is the balloon part of the aneurysm. There are all areas where the colors are slightly different, show places where there is differences in time averaged wall shear stress and time averaged wall shear stress gradient. Similar results are seen in the third and fourth patients simulations, where there are inconsistent velocity profile changes between both of them. You can also see in the CFD simulation results that the percent change difference between the patients are not the same, but there is also variation between the time averaged wall shear stress percent change and the time averaged wall shear stress gradient change. You can see there's 9.27 for time averaged wall shear stress, whereas for time averaged wall shear stress gradient, it's 19.51. So there's not only a difference between the patients, but also between the two parameters assessed for the same patient. Although the sample size was not big enough to be statistically significant, we can see that using the data I just showed, changing inlet boundary conditions can have an unpredictable effect on CFD results. This just means that moving forward, if we want to use CFD to model patient aneurysms in a clinical use, that patient specificity is critical for accuracy, and we want to use patient demographic data when generating these inlet boundary conditions, as we want to be accurately representing these patients if we want to use these models for patient care determination. I also want to note that all the work I just presented was used for pre-treatment cases, so all these aneurysms were before those patients underwent treatment. But there is future research that is working on further optimizing CFD modeling of endovascular coiling of aneurysms. So endovascular coiling is a method of treatment for aneurysms right now. However, there is a bit of a recurrence rate, and we want to avoid that recurrence rate so that patients don't have that aneurysm again. So we want to be able to improve the modeling of coiled aneurysms to better predict outcomes. And hopefully the use of CFD in clinical applications will lead to better treatment and better outcomes for aneurysm patients in the future. Okay, I want to say thank you to Dr. Ellen Bogan, Mrs. Ellen Bogan, Dr. McDonald, Julie, and everyone else who made this program possible. And another big shout out to the SANS lab. Thank you so much for having me this summer. So Dr. Patrick Fillingham, Dr. Mike Levitt, my mentors, Keiko and Ashton, lab partners Fatima and Nate, and finally Dr. Zachary Abacassis for working with me on the CFD project. It's been a really great summer.